Hey Kelly, how are
Hey,
you?
Lushniak. Good, how are you?
Good. Sorry for my delay here.
No, don't apologize at all. There's nothing else I'm doing on a noon on Wednesday, so you're good. But how's your day so far?
Good. Usual day of multiple meetings, everything happening at once, and uh, nonstop, nonstop excitement. A lot
Busy.
going on, and a lot of discussions about the fall and how we're trying to prepare for things. So all is good.
That's so exciting. And that's good that these discussions are happening now to plan out the fall and everything.
Hmm.
Yeah, so this week I'm so excited that we're back to Instagram because it's a lot more student centered and I feel like people just drop questions a lot easier on Instagram, so this will be fun.
Right.
But just for everyone who's watching, please feel free to comment any single question you might have, and we'll definitely make sure to get to it. This week we have a few questions submitted just like about student concerns and like support during this time, and then also just I'm curious about like the town hall yesterday and like how that went. So if you, Dean Lushniak, could just like give us a rundown of like different things that have been happening this week and different meetings that you might have had.
Sure. And first of all, again, thank you, Kelly, for being
Of
sort of the
course.
leader on this week after week. We're sort of doing this connectivity, and it really is critical that the connectivity is just not you and me talking; it's with everyone who's in our community. So we've made it well known throughout the university community. This is not just a School of Public Health thing. So hopefully, we have not only our own family at the School of Public Health, but also
Mm-hmm.
the family from the wider College Park community, and that includes students, staff, and faculty. The COVID-19 obviously continues as a major public health crisis throughout the globe. Looking at the current numbers, just so we update you on the epidemiology, is we're up to almost 3.7 million cases worldwide, just short of that right now, with about 1.2 million of those within the United States. So we remain the epicenter of everything that's going on worldwide. Right now, globally, we have over 250,000 people who have unfortunately died from this disease. In the United States, we're over 71,000 deaths. And once again, to put that into worldly perspectives of things, when we talk about our annual influenza mortality, deaths from influenza, in a bad year, it may be as high as 50,000 in a bad year. If we look back into historically, we've talked about this, the 2019, 1918, 1919 flu. We had over 600,000 deaths in the United States estimated. So this is now becoming obviously every day a major, major event in terms of both the morbidity, the sickness, and the mortality and the deaths associated with this. Um, there's obviously been a lot of movement over this last week in terms of states beginning to want to reopen and slow movements in that pathway. Here in Maryland, we remain where we've been before, which is Governor Hogan is looking at the information coming in, the data that's out there. And we're looking for a 14-day period of decreasing numbers. And in general, that's decreasing numbers when it comes to hospitalizations, decreasing numbers when it comes to deaths. We're on the upward surge in terms of number of cases that are being diagnosed. But don't forget, to everybody that's out there, is that sometimes that's a reflection of the amount of testing that we're doing.
Mm-hmm.
And so I kind of look at numbers of cases directly correlated with testing, and I'm really looking at the hospitalization as deaths of a sense of how serious things are getting. And what we want is a stabilization of both those numbers. The way the plan is supposed to be set up in terms of reopening is you're supposed to have 14 days of decreasing numbers, and then you go through a phased reopening. And we're still not even at the phase one right now here within Maryland, within our region. We still have an increasing or a plateau of cases in some cases, in some situations, but we haven't seen that decrease occur as yet. So we're anticipating that, and the hope is that in the next few weeks we'll get some news in terms of us, for want of a better term, reopening society. Um, Other big news, the health equity issue remains a big issue. We had Dr. Thomas on a few weeks ago and talking about the disparities that exist out there. The latest numbers, and this was covered in the Diamondback today with a good article where a lot of our faculty were profiled or interviewed in that. We really have to look at the idea of disparities in our communities and why we're seeing this increase of both illness, hospitalizations, and deaths within our underrepresented minority communities. We need to tackle that head on, and there's a lot of good ideas and some progress in discussions at the state level and even at the national level that's going on with our Maryland Center for Health Equity as a lead. Our interactions with state and locals continue as well. We've now had several groups of students that have been trained as contact tracers here locally for Prince George's County. The negative aspect of this is that they've required, because of their systems, is that this needs to be, conducted at a site from Prince George's County. So it's difficult for us to sort of expand this to all our students throughout the United States and go, you can become a contact tracer. So the initial training was also done in person. I think we've expanded that to now include contact tracing training that can be done sort of virtually, but then the actual work needs to be done out of Prince George's County. So I'm very proud of the volunteerism that's existed out there, in terms of our faculty, staff, and students coming to the support of state and local health departments. And then finally, let me just sort of update you on where we're at the university level. Yesterday, we held a town hall, multiple leaders, and I was asked to be part of that town hall to give the public health perspective. A lot of great questions from the community. I think we had over 3,000 participants in the town hall yesterday from faculty, staff, and students. So, and a lot of questions that went unanswered just because of the
amount of time
issue, right? But, a lot of good questions directed towards me as the public health guy, as the medical guy, we're trying to make sure that we're progressing ahead. Also at the university level is President Lowe, who everyone knows is the outgoing president. He still remains president until July 1st. And then Dr. Daryl Pines, the current Dean of Engineering, actually he's no longer Dean of Engineering, that's been handed over. So Daryl Pines will take over as the new president of the University of Maryland on July 1st. Both have been very active in terms of this approach. Daryl Pines has been working with the University of Maryland system and with the new chancellor there, with Dr. Jay Perman, and making sure that we have that connectivity with the whole system in terms of a coordinated response from the University of Maryland system. And at the same time, President Lowe, in his current role as president, is the architect of what's now being deemed sort of these various task forces and working groups with the goal of what's our plan for reopening. And we're now focused on this idea of looking at the fall and what's the fall going to look like. And to everyone out there, the best I can tell you right now is we're looking at this. As you can imagine, I mean, you sort of place yourself in the position of a decision maker, right? And the decisions need to be made, let's say by early June, mid-June. But you're forecasting of what's going to be going on in July and August and into September. And you have the limitations. And I'm not looking for your sympathy here, right? What I'm telling you is this is the reality. For you public health students out there, realize that this is public health decision making, right? Oftentimes, right, we're put into the realm of kind of saying, okay, what's going to be happening? And you have to make the best decision for what? First and foremost, it's the health and safety of our whole community. And our community, the one I'm responsible for, that we leadership of the university are responsible for, are the 52,000 people, right? And why 52,000? Roughly 40,000, right, students, 30,000 undergrads, 10,000 graduate students, add another 12,000 faculty, staff, right, supporting this whole endeavor. And it's a community of 52,000. And yet this community is not an island unto itself. We have to try to protect that community, there, but this is a bigger problem, right? This is a county problem, a state problem, a regional problem, a national problem, an international problem. So right now we're in that whole issue of scenario planning, which is how do we try to open up? What's the right pathway to opening up? And how do we do it so that we, based upon the current information and parameters, make the best decisions for everybody's health and safety? So it is at times kind of this overwhelming task, if you will. But, you know, we're there and we're pushing ahead. And it's really in all realms. So I'm a co-chair along with Mike Potterella, who's the chief, the general counsel, so the chief lawyer of the university. So he and I are co-chairing the health, safety, and risk mitigation group. But also you have groups that are looking from the student aspect, right? And that includes the resident halls, right? There's another group looking at the academic thing, which is how do we teach with all these rules, right, in place, right? Regarding even the physical distancing and the mask wear and, you know, the whole idea of limited social gatherings. If we take today's rules, right, which are in place for the state of Maryland, an optimist, which I am, will say they'll be somewhat different in the fall, but we know that we won't go back to completely a normal society in the fall, that COVID-19 is still going to be around to some extent. So how do we decrease risk for everybody? So that's kind of where we're at right now. You know, a lot of moving targets and a lot of progress. It's slow and concerted. In the meantime, you know, and I'll repeat this message at the end once again, is do what you're doing, right? From our students' perspective, right? Keep studying. This is, you know, that time period where you're probably preparing for your final projects, your exams, your, you know, everything going on. At some point, the academic year is going to end. And then life becomes a little bit different for you. But concentrate on your academics, concentrate on your staying healthy, both physically and mentally, and begin planning for something for the summer, right? Summer is going to be different this year. So that's from the student perspective. From the faculty and staff that may be on to a large extent is we want to get you back in the workplace, but we can't do it until it's safe and we can assure as much as we possibly can that it's going to be a healthy environment. So in the meantime, continue doing your jobs, right? Do it well, dedicate yourself to the same things I just mentioned to the students, the physical fitness, mental fitness, as well as being part of a team. So that's kind of where we're at, Kelly.
That sounds great. I have no idea how to juggle all of those moving pieces, and I don't think anyone does, but it's good that you have so many like people, like just different leaders across campus coming together to do this. Is there any way like students can submit ideas to like different like people involved in work groups or whatever? I'm sure that, you know, there are trained professionals, but also it's good to have like student feedback and input.
And without a doubt, most of the groups are going to be reaching out to students regarding membership on these task forces. So we always look at the idea of we are a community, and many of the task forces or work groups will be seeking out student leadership. So my sense is if you want to volunteer for one of these positions, probably the best person to turn to would be Patty Barillo at Student Affairs. I don't want to inundate her with things, but she's the one who's sort of in the world of student affairs and the world of making sure that our students are feeling connected. But, you know, to a large extent, we need to make sure we have student input as well as faculty and staff input, right? This isn't just a bunch of people sitting in the room making decisions for the community and not having the community presence out there.
That's good. And I actually tuned into the town hall yesterday for probably 30 minutes. And there was some conversation about large lecture halls if we return to campus and just like renting out different venues and like different things like that. So what are your thoughts about large lecture halls in general when we return to campus?
Yeah, you know, so for example, I think our largest lecture hall, according to the provost, is something like 500 seats, right? So that's a large place. Now, the problem is if I'm functioning under the current rules, which is, okay, I want to keep everybody, and imagine this, I mentioned this yesterday, imagine all of us have a circle around us of 6 feet, right? Let's say it's a hoop that we're wearing and it's 6 feet, you know, around us. Ultimately, to be able to put students in that lecture hall of what you normally would seat 500, you'd somewhat, you know, and this is the calculations done by the provost, is you would actually limit the size of that lecture hall to about 50 something students. So it goes from 500 to 50, right? Because of that 6-foot rule,
Yeah.
right? Because now you're blocking
It's in all
out the seats
directions.
around you. So the question, of course, is the larger venues are almost impossible to be able to organize, right? If we're following that 6-foot rule. Now we have to think outside the box, right? And part of the discussions are all larger lectures now then, because of that calculation, being put online, right? Is that a default? I'm not saying we're there, but that needs to be part of this discussion.
Yeah.
Or do we somehow break up the larger lectures into multiple smaller lectures, right? How do you sort of assure, you know, is it really online? Is it being videotaped in? Is whatever? How do we get people in the classroom having the ability to interact, yet not necessarily all together? Do we look at other venues? And, you know, let's even talk about that, right? And this is just, you know, discussions I've had, you know, which is our biggest lecture hall, in essence, on the whole campus is really what? The Xfinity Center.
Xfinity, yeah.
Right? So can I fit 500 people separated in the Xfinity? Yeah. Does it take away from that experience? Right? It's really kind of bizarre to think that your 500 person lecture hall now is in the Xfinity. The professor's down there near the basketball hoop, right? And it's all on the big screen. And is that what we're trying to achieve? Right? With each of these decisions, Kelly, I think there's going to be the sense of there's a benefit and there's a risk. And the question is, how do we mitigate that risk?
Mitigate the risk.
Right. How do we do what we need to get done with an in-person scenario without putting people at undue risk?
That makes a lot of sense. And I saw actually like a tweet yesterday where someone said that like Econ 200 in the Xfinity Center or something like that. And that is just so different to think about right now. But if that's like the safest thing, then that's what we should be doing. You know, it's just, even if it's not the old normal, we still have to adjust. And okay, so this is actually a question submitted like right now, and it kind of deals with this, but it's from Sarah. And how would places like Stamp or Xfinity change next year?
Well, again, you know, it all depends on what phase we're at the time period. If you look at this phase approach, right? And I'll ask people to kind of look this up. Look at the Opening America Up Again plan that came from the White House. It really delineates phases that we're going through, and it kind of aligns with what some of the states, including the state of Maryland, are doing. Obviously, we're in the state of Maryland. It doesn't matter if you, a student, are coming to us from California or New York. When you're here, you're in Maryland, and we're going to be having to follow the Maryland sort of approach to things, right? The rules of our region. My hope is that we're still going to keep it a regional approach, which is what happens in Maryland, hopefully happens more or less in Virginia, and happens more or less in the district. Some parts of the country have been looking at that. But when you look at the idea of what phase are we at when we enter the fall, worst case scenario is what? Is we're, you know, it can actually get worse, but I don't even want to go there, right? So, but the phase that we're at right now, which is I'm wearing a mask if I go out in public, and I'm told stay away 6 feet or more from other people. Now imagine the Stamp or imagine the Xfinity Center functioning with those rules. It's a whole different scenario. So the reality is that all these activities are very different. If I'm really spacing people apart by 6 feet and all are in masks, you know, and then you add in the idea of making sure that everybody's washing their hands all the time. We have all those facilities, all the signage is out, but we have a different texture, right? Now, again, if we succeed in decreasing the number of, you know, hospitalizations and decreasing the deaths, and yes, hopefully at some point when we're up to testing, seeing a decrease in testing, then we can start liberalizing that, right? And to some extent, it's hard to predict where we're going to be at in August or September. But at some point, maybe we'll resort to this idea of saying, okay, the 6 foot rule is no longer out there. Well, that changes the texture. And maybe we're wearing masks and emphasizing the idea of hand washing and doing testing of individuals, right? So you got to throw that into the scope. And people who are positive are taken care of appropriately, right? Isolated or quarantined if you've come in contact with a person who's positive. And we begin really snuffing out the disease with the basics of epidemiology, which is, testing, 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 contact tracing, contact tracing, contact tracing, treating, 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 and then isolating or quarantining, right? So if we get to that stage, we can begin to almost, return to normal with the idea that we're much more aggressive in terms of finding people who are carrying the COVID-19 and finding people who are ill with it, right? But we have to get to that stage first. So the fall can be almost anything. If we're successful in decreasing cases, then potentially it becomes not completely back to normal, but more of a normal, right? And again, maybe we'll be wearing masks and we'll be, and maybe we, we'll still be cognizant of this idea of large group activities not taking place, but maybe the 6-foot rule goes away at some point. It's difficult to determine, but, so the person who asked that question, anything is possible, and certainly it's not going to be back to complete normal.
And then I guess just going off of that, another person, Nat, submitted a question, which is like bringing it into even the broader space. But what are your thoughts about outdoor areas opening? And then, for example, they said like Ocean City or something.
Yeah, and we've seen a lot about that in the press, right? When you see what's going on out there and beaches open. Images, I think it was from Southern California last week, where beaches were open and all of a sudden it's a free-for-all, right? There's thousands of people not necessarily following the 6-foot rule, not necessarily staying away from each other, not necessarily wearing masks. Well, guess what? From a public health aspect, that's a setup for a disaster. Because don't forget, several factors we've talked about on this show before. One is anywhere between 25 and 50%. Remember that. That's, a quarter to a half of people who are carrying the virus, right, are asymptomatic. So if I'm one of those beachgoers and I'm like saying, hey, I feel really good, and boy, the sun makes me feel fine. Although, I'm also a dermatologist, so stay away from burning and make sure you don't do indoor tanning and prevent skin cancers. That all doesn't go away to the wayside. SPH, right. So SPF, right. So anyhow,
SPF, sorry.
SPH is us, SPF is the creams. But anyhow, so the reality is that, because of this asymptomatic stage, I can't just say, if you're feeling healthy, go to the beach and don't bother, right? This asymptomatic thing is really bothersome. So the whole issue of Ocean City, if we just have a free-for-all in Ocean City saying, oh, go out and do what you want, well, all of a sudden, I now have a potential source of incredible transmissibility of infections. Potential, right? Yes, it's outdoors. That helps, right? So the outdoor environment, I have fresh air, but still doesn't bring me down to zero. And if I have thousands of people out there, am I potentially still spreading the disease? So that within 14 days, some percentage of that population is now sick or now have become healthy carriers, and I don't stop this thing. Okay? Outdoors is good. But right now, what I'm looking at is the outdoors opening up in kind of smaller venues, right, where it doesn't allow for the congregation. So a beach is a problem. Beach is pretty, but it's also vast. Unless I really cordon off areas and say, this is your spot and you're 6 feet away, which is always a potential, and I limit the flow of individuals onto that beach saying, hey, we're maintaining the 6-foot rule and we're maintaining the idea that you should be wearing masks if you're out in public like this, then it could work. But it can't work if it's just a free-for-all. I went bicycling last week, and I'm a big-time bicyclist, and so are members of my family and our friends, and we actually went for a nice bike ride last week, and it's one of my favorite rides. Those of you who are here in Maryland, near the district, know perhaps Rock Creek Park, and Rock Creek Park sort of goes up from Rockville, which is where I live, and then meanders down all the way to the district, to the National Zoo, to that area. We didn't do a real long ride. I think it was ultimately 22 miles round trip. So, it was a nice ride. But along that way, there's a drive called Beach Drive. And Beach Drive in D.C. is actually closed between Friday night and Sunday evening year-round in the district as a recreational pathway. So this is a 2-lane road that's very beautiful. It almost looks like a national park and meanders through. But now Montgomery County closed about a 2-mile stretch of that same beach drive in Montgomery County. And as we rode, took us 7 or 8 miles just to get to the closed section. What did we see there, right? What we saw there was a closed off road that normally is actually open all the time, right? Montgomery County doesn't close this off. And there were people out there having fun. Because it's a 2-lane road, you can separate. People were rollerblading, they were running, they were biking, they were walking. And because there was space and there was movement, that allowed people to actually have a great time outdoors without necessarily breaking the 6-foot rule and without putting anybody at risk. So the Ocean City thing, again, unless really well organized and you put out the plots of 6 feet, you know, I'm against that right now at this stage, but there are other options. And I'm glad that Montgomery County began looking at this. I'm glad that the district began looking at this, right? We need to be able to get out. That's an important part.
Mm-hmm. And then going into just different ways that you relieve stress, like bike rides and walks and stuff, what is your advice for students who are feeling doubly as stressed right now? Like, I know personally, I am so stressed out right now, just like thinking about everything around me, or if I'm not productive during this time and I need to be productive because finals are approaching. So what's your advice for students who are definitely going through this?
Yeah, and you know, I'll be honest with you, you know, I mentioned this several times, is, you know, I have 2 daughters at home right now. And you know, and part of it is the stress that I'm seeing they're going through, right? Younger daughter doing her final exam this afternoon in just an hour or so in her whatever cell biology course. So, you know, I see that in front of my very eyes, right? Which is, okay, I got to study for this and that. And she's also not been feeling well over the last couple of days. So it's, you know, kind of this whole sense, which many of our students have gone through. You know, she had to get in contact with the professor. Didn't take the final a few days ago because she was in an emergency room, not feeling well, right? Now still not feeling great, but the stress of kind of just having that completion, you know, in front of you. My suggestion regarding stress is, you know, number one, I can't take stress away for you as students. I can't take stressors away from my faculty or staff that are out there. It's a terrible thing to say that is stress really part of life? We'd like to say, oh, no, we can fare. No, unfortunately, there is that sense of, you know, how we deal with the uncertainty, how we deal with pressures. My goal in all this is to make sure that our students are at least given the tools. It's not just students, it's faculty and staff to be resilient, right? To be not denying stress, but how do you make sure that you handle it well? Part of the factor is bite off as much as you can chew. Don't think too far into the future. And I'm seeing that in my own daughters, right? Which is right now, my younger daughter's emphasis needs to be this exam this afternoon. Right? I can't take away the stress. She's got to sit there for an hour and a half, answer a bunch of questions online, and hope she does well. What I don't want her to be thinking about right now is, what am I doing this summer? Because my job that I was supposed to be doing is no longer taking place. And what am I going to be doing in the fall? Because I don't know what my university is going to be doing. Break it into pieces, right? I can't take the stress away. What I can say is, if you think about too many things, right, at once, that's overwhelming. Now, even when you bite off all you can chew, right, at once, how do you deal with it? Well, it's the whole idea of finding out what works for you and try a little bit of everything. Try exercise as a stress reliever. Try meditation, try yoga, try contemplation, try journaling. For each of us, there is a pathway of determining how we can handle stress. Again, the goal in life is that it'll never go down to 0. But the question is, how do we learn to handle that stress? And how do we are able to put it into compartments that we can handle sort of one stressor at a time? My older daughter, I'll use her as an example, right? Big time decision this past week. She's been stressed out for months over this, and she finally, you know, she lucked out in that she had several medical school acceptances, and she needed to make a decision where she wanted to go. Completely stressed out over that. Finally makes the decision. Feels good for about 24 hours, and then does 2 things. One of which starts doubting that decision, right?
Yeah.
And the best I can say is, no, listen, you made it. You can't go backwards, right? Now look forward. And now, to a large extent, it's okay. Well, now I have to find a place to live. I have to find a roommate. I have to, right? Compartmentalize, right? Don't sort of take it on saying, I have to do everything at once. And this on top of a stressor, which is she's starting a brand new graduate school. She's starting medical school sometime. They've already postponed the start from July to September. That's already a stressor, right? Because you were geared up to go and start. And what I'm advising my own kids, and I'd love to sort of say I'm advising everybody around me, my whole community, is, you know, this is from our students, undergrads, graduate students, to our faculty and staff, is figure out how to handle it and only look at small chunks of that stress, right? Don't get overwhelmed. You know, I find myself the same thing. You know, if I start thinking about the responsibilities of being part of the decision makers of what's going on at the University of Maryland, you know, for the fall, and I put that on top of the short-term stressors that tomorrow night I'm going to be on Wolf Blitzer with CNN again. Do I need to prepare for that? How is that going to look? And if I put that on some of the decisions we're making about what the school's doing right now, boy, you can really blow your mind right too quickly. Compartmentalize. Yep.
I think one thing that I've been doing that has been really helpful is just like celebrating a lot. And I know that sounds really stupid, but like if I were to get, say, a good grade on an exam or whatever, like even if I have 8 more assignments to do that day, I'll make sure to like stop my day, like get a cookie or like, you know, just like relax and like acknowledge those accomplishments. And I feel like that's like really hard to do during this time when everything else like around you like seems like it's just like falling apart. But I think it's really important.
And let me add one thing that I mentioned, even as sort of as an aside yesterday during the town hall. Right, celebrating, great. Be really careful, right, of bad ways of celebrating. You know, and you know, I'm turning to everybody out there. Is that, you know, we know right now, even based upon data that's coming in, is the amount of alcohol use is going up, right? People are sitting around and saying, hey, listen, okay, I don't have to go into work or school tomorrow. You know, I'll finish off that bottle of wine at dinner, right? It's that whole sense. Is that, you know, just make sure that we're all really careful of the people around us and of us ourselves, making sure we're celebrating in a great, now I know you, Kelly, are, but, you know, for the world out there, I don't want this misconstrued of all of a sudden we're opening champagne bottles with every celebration and completing the whole bottle, right? Be real careful, because what we know for a fact is during times of crisis like this, people who have had a history of substance abuse tend to have steps backwards, right, in the midst of that. That's one of the stress aspects, and maybe their support structures are no longer there. For us others, it's just have to temper this idea that we don't want to get into, you know, bad habits and bad ways of doing things in the midst of this, you know, well, we're in the midst of the pandemic, so who the hell cares, right? You know, let's be careful of drug use, abuse. Let's be careful of substance abuse. Find those healthy ways of dealing with things, right? There are proper ways of dealing with stress and improper ways of dealing with stress. But I'm glad you're celebrating, because I think that is a good way of kind of saying, you know, it is an attitude issue, right? Because part of the reason you're celebrating is, okay, so what good happened today, right? Or in the last couple of days? And how can I look at the world differently?
Yeah. One of my favorite quotes is, every day might not be good, but there's good in every day. So like, even if overall the day seems kind of like gray or whatever, it's like, oh, well, you know, I texted an old friend or whatever. And like, you just have to look for those little like silver linings and go with it. But another question we have is just like, how can students support other students during this time? Because like, I know personally, like I like when I'm on campus, it's so easy to see when my friends are like going through different things and trying to help out and like try to be there for them. But like, how can we do that through this like online connected society?
Yeah, I think, you know, and we mentioned this briefly yesterday during the town hall, is that, you know, we probably started out with bad lexicon, bad terminology, right? We used the term social distancing, right, as being the key factor. The more precise term is physical distancing, right? We want people to stay away from each other in terms of physical presence, right? The 6-foot rule is not my heart, my soul, and my spirit. It's my body 6 feet from another individual. And so, you know, how do we support fellow students is reaching out to people, right? You know, finding out who they are, you know, finding out what they're worried about. In the world of physical distancing, you know, we're not running into each other in the classroom anymore. We're not running into each other, those of you who lived on campus in the dorms or in college, apartments in College Park, we're separated. And so physical distancing has been thrust upon us. But social distancing is something we have to work at. And that includes our fellow students, which is, if you know somebody in your class, you've seen them on the screen or whatever, find out who they are, right? Or just set up, be bold in this, right? The whole idea of the Zoom chat world. Well, it's easy to reply to an invite if somebody has said, oh, I'm going to do a class Zoom chat tonight, right? Or let's just set up a time to talk, members of this class, versus being the instigator of it, right? And why don't we all become instigators? And the reality is success isn't 100% turnout. Success is one other person that you've not met before that you get a chance to talk to and connect with, right? How do we, in the midst of a pandemic, really exhibit caring for others? It's reaching out, it's talking, it's saying, hey, listen, I've seen you from afar. Tell me about yourself, right? This can continue beyond the academic world, right? I can't say what the next weeks are going to bring. My optimism says that we're going to be opening up and things are going to get better. But if we remain at some kind of strange stability for a while, right, and things don't open up, let's begin planning of how we're going to reach out. I'll provide two examples of even reaching out, not just to our current sort of social group, but people from our past, right? I have another one scheduled tonight, had one a few weeks ago. So I'm connecting up with a group that when I started my career 30 years ago at the Centers for Disease Control and Prevention, we all worked together. We all remained friends over the years, but just like anything, we're all no longer in Cincinnati, Ohio, which is the laboratory we all worked at. Everybody's all over the place. And now is our second in 3 or 4 weeks of a Zoom get-together, right? We call it a Zoom happy hour. It doesn't always denote heavy drinking and sitting around and, it's a happy hour because we want to make each other happy, right? And that's an example of the connections not only with our present, but connections with our past. This is a perfect time to tell people, right? To have them catch up on things, right? To share ideas, to share fears, and to share aspirations. So there is a pathway. Sometimes we have to be the instigators.
Is a really optimistic way to look at it. And also that's so fun that you have those connections that you could just reach back into 30 years ago and just have a Zoom call with them, which is really great.
Yeah, unfortunately, they all look really old, to me. And so I'm wondering what the hell do I look like when they're looking at me? But, 30 years.
You're wearing SPF. You're good. Like, don't worry about it. You're drinking water. It's good. But then also, so someone just said another question was just about, do you agree with like Ocean City, Maryland mayor about opening the beaches in general, which you touched upon earlier?
Yeah, I touched upon it. Again, let me just sort of reiterate, right? Outdoors is good. Having fun in that social realm is okay. It can't be totally unregulated. If the Ocean City mayor wants to do it right. Set up your little sort of designated areas and keep reminding people, right? This is loudspeaker time where you basically say, as we're in the midst of a COVID-19 pandemic that has serious health repercussions, take care of yourselves while you're out here. It's got to be done right.
Awesome. And then also there's something that came up just like last week that I would love for you to talk about. There was a viral tweet that surfaced from a student at UMD who didn't really receive like adequate support from her professor. And the tweet really took off and just sparked a lot of conversation. So what are your thoughts about this tweet and if you know about it? And then also how are we advocating for students who aren't the loudest voices in the room? Because this one student probably, unfortunately, is not the only one with this situation.
Yeah, I much like everybody else was just flabbergasted by that exchange between the professor and the student at a time of extreme pain and hardship, right? And those of you who don't know, at least what was circulated on social media, and I imagine was investigated by the university, was the sense of one of our, students at the university whose, father had died of COVID-19. And there seemed to be a total disregard from the faculty's perspective in terms of the postponement of assignments, the postponement of a test, an understanding there. That was immediately circulated from the provost to all of the deans. And I'll tell you, within our circle out there, it was unfriggin' believable, right, that this had happened. I just, and I showed my daughters and I showed my wife, and I was embarrassed, for society, right? The reality is what? Yeah, we can't control all aspects of our community, right? The best we can do is learn from unfortunate scenarios like that and make sure that, one, that the student that was affected in this case is taken care of and is told that we care about that student. That starts the healing process. Number two, and almost all the deans, if not all the deans did this, and this is what the provost had requested, was circulate this to your faculty, right, and staff, and make sure that, we are pushing on this message that these are difficult times for everyone, right? These are difficult times for our faculty. These are difficult times for our staff. These are difficult times for our students. But the way we handle difficulty is through understanding, through compassion, through grace, and to, in essence, loving each other a little bit more, right? That's how we deal. And that, I think, was the message, was, not that we have to sort of, what I don't want it to be the message saying, because we have a crisis, we have to give every single, that this is a charade, this educational process. It can't be a charade. We have expectations as educators that students are learning. It's not under the most perfect, and we need to maintain standards of grading. There's the pass-fail option. There's things going on. Nothing perfect, but that students are accountable. This isn't supposed to be a total blow-off semester. On the other hand, this is so unique in the lifetime of all of us that we have to have understanding and compassion out there. And I think that's what we need to be reminded of.
Thank you. And that's great that deans and different academic professors are aware of the tweet that happened, and just making sure that we're taking the proper preventative measures that can't happen again for other students, and just knowing that students feel supported in the community. I feel like that's really important during this time now. But as we're getting to later in the hour, I'd love for people watching this to submit any questions that they might have, so we could just go through your questions too and make this as tailored to what students want. A few questions that I missed just because I wasn't paying attention, but from Alyssa Brooks, she asked, how can alumni support students during this time?
Well, I think, first of all, Alyssa, hi out there. Alyssa's our president of the alumni network.
Awesome.
And I think that, when we look at just the volunteerism that goes on, there's two aspects of reaching out to our alums. One is in the realm of, yes, I'll put it out there, financial support, right? We have at the university various funds that are available for students that have hit incredibly difficult financial times, right? Different aid funds that are out there. And so for those alums who are capable, the whole idea of writing a check and saying that this is designated for one of the funds out there that support students in the time of need is one way that an alum who's out there, who's hopefully in the working world, yes, not separated for everything that's going on. We're all being, economically affected, but to have that compassion. Second aspect is one of the things we're dealing with throughout the whole university, but specifically in the School of Public Health, is the disruption of internship opportunities. So if I have alums out there who can come up with novel ways, novel approaches for this coming summer for internship opportunities that would be through online, if they themselves have jobs where they wouldn't mind taking somebody under their wing and providing them some guidance. It's not the perfect internship, but we want to make sure that our students walk away with some real life practical aspects. So that's the second aspect to our alums. And the third is just activism in the alumni network, right? Joining is great. Leading is the next step of this. And what we're looking for, we're a school that's only existed for 13 years now, right? As a school of public health. So I have 13 years worth of alums that feel as if they came from a school of public health. But we also have legacy alums. We have members of our alumni network who graduated in the 80s and 90s and before we were a school who feel connected. And I'm asking all our alums is no matter when you graduated, you are part of us, right? The school may not have been a school of public health, but perhaps the department was kinesiology, or perhaps it was family science, right? At the same time that we celebrated roughly our 13th anniversary or our 10th anniversary, 2 years later, kinesiology, believe it or not, celebrated their 125th anniversary as a department at the university. So my sense is, no matter how you fit in, if you have an association with the School of Public Health in any fashion, legacy or currently, join up with the alumni network and figure out a way to make us better. Because this isn't going to end tomorrow, right? Your check will be helpful to help me for our needy students for the next few weeks or months. But this is going to go on to some fashion in the fall. Well, let's talk about the idea of student mentoring, right? In the fall, and maybe some of it's being conducted online as opposed to the get-togethers that we've had at the School of Public Health. I need more people to be involved in that. So, Alyssa, great question, and thank you for your leadership.
Awesome. Another question we got is from Nat Corson. So here, actually, I'm going to try this. It says we can put questions on the screen. Oh, perfect. Okay, so Nat's interested in what Dean Lushniak thinks about secondary effects of the pandemic, like if doctors are only taking emergency visits or delaying care.
Yeah, so let's talk about two things, right? There's a lot of secondary effects of the pandemic. First of all, let's talk about the individual who has had COVID-19 as a disease. And, we're learning a whole lot each and every time. I can't emphasize enough that, we didn't know anything about this virus until late December, early January. So, I'm kind of losing sense of what month we're in and what day we're in. But by my count, it's January, February, March, April, May. So we're 4 or 5 months into this. And we're still learning all the time. So in terms of personal secondary health effects, which I know isn't the question, but I'm going to go there, is that we're learning all the time is, initially it was all, well, the majority of people have real mild symptoms. Okay, fine. We went from that to saying maybe the majority have no symptoms. And then those who have symptoms have mild symptoms, but we also keep finding out new things, right? There's been this recent things in the press just in the last few days in the medical press and elsewhere of children, pediatric patients with COVID-19, some of who are developing really serious effects from it, right? Full organ failure, right? A sense of, is their immune system overreacting in some fashion? Is there this inflammatory component, which includes the heart for young kids, right? So we're learning about that. There was some news in the last few weeks about all of a sudden an increase of strokes in youngish people, 30 to 50, people who ordinarily would not have strokes and coagulation disorders. I'm a dermatologist as well as other things, right? The derm community is following something called purple toe, which is in essence a vascular disorder of the extremities associated with this. So we're still learning a whole lot 5 months in about this disease and its secondary health effects. But in terms of the other secondary health effects used here in the examples, yeah, we're learning a whole lot of how things are being postponed. What was interesting was, in New York, at the heyday of, when things were really bad in New York, and they're still not great, but, when the ERs were inundated, the doctors and nurses and others, and by the way, today's National Nurses Day, so if we have nurses out there, go nurses, and people who are out there doing incredible things. But doctors and nurses were noticing that where have all the people with heart attacks and the people with strokes and other things and people with diabetes and reactions, that where have they all gone? Because they're not showing up. And I think that's a disconcerting part of this, right? If you yourself get ill and you sort of say, I have a problem, I'll just wait on it. Are people dying at home that we don't know about? I mean, we're going to see a lot of these secondary effects because medicine and medical care has been postponed. So a lot of doctors' offices closed down. It became telehealth. A lot of people were fearful of going outside their home to doctors' offices or to emergency rooms. And so I think we're going to learn more about how all of a sudden when the system does get inundated, what gets diverted and what gets deferred in terms of medical care. Even now, and I'm going to provide an example in terms of preventive medicine, and this is a biggie for me because I'm also a preventive medicine doc, right? And part of this is pediatricians are describing this idea. They haven't had their practices open necessarily. Some are holding immunization clinics, but immunizations for little kids are going down drastically. If this continues for too long, all of a sudden, am I going to have a measles outbreak on top of everything else soon, right? Because we're not immunizing. These are preventive measures that are critical, right, to maintaining the health of our society. So that's a great question.
Thank you for taking that on so many different angles too. Another thing that people have brought up is how can we support DACA students, especially those with mixed immigration statuses and their families?
Yeah, I think, in the midst of all this, we already were out there, fighting the fight for DACA students prior to all this. Two things that are going on, one of which is this is amongst the underrepresented minority that we're very concerned about, right? It's the African American community, it's a Hispanic, Latina community that exists out there. And it's to some extent interlaced with the idea of the undocumented individuals out there who are fearful of seeking care, right? I'm not going to go to a doctor. First of all, I don't have coverage. Secondly is, what if I put myself at risk? For our students, we have to be able to reach out. We have to have compassion, and we have to feel that you give them all that feeling like we're trying to do for all our students. Somebody's caring about you. Somebody's reaching out, and somebody wants this to make sure it works out, that you're taking care of yourself physically, mentally, socially, but also that you feel part of a larger community. Reach out.
Awesome. And then it looks like that's it for submitted questions, but if people want to submit questions, please continue to do so. And I'll just ask Dean Lushniak if you have any last words or closing thoughts about our conversation today.
I mentioned National Nurses Day. This is also Teacher Appreciation Week. So, I know it's been tough this semester. It's been tough for students. It's been tough for faculty and staff. But, if you feel it in you, send a little note to some of your teachers. And it doesn't have to be your current teacher. I don't want you to fake it saying, oh, you're doing great if they're not doing great. But look back even at your lives. This isn't just sort of your university teacher, but if you have somebody out there who's touched you, right, academically has reached out and mentored you, that has connected with you in some fashion. It could be in high school, it could be in grade school. But what a great time during this Teachers Appreciation Week to reach out and say, hey, listen, you may not even remember me, but I remember you, and this is what you did for me. With two daughters, as I mentioned, who are in the academic world as you are as students, I have to keep reminding of that there's no more special joy as an educator than getting a surprise email. And it's not the whole issue that you're somehow, buttering up the professor, right? It's got to come from the soul, right? But there's no greater satisfaction for somebody who's out there that gets an unexpected email or a text message and says, hey, listen, gotta thank you. Thank you for what you've done for me. And in particular, for our graduates, right? The individuals who are out there finishing up your time, University of Maryland. I always say, and usually this is part of my message, on that day as you're celebrating, this year's going to be a different type of celebration. Do thank somebody. It could be a teacher, it could be a parent, it could be a loved one, a family member, it could be a partner, it can be anybody. But thank people, right? That thank you goes a long way. And maybe our society has sort of gotten used to this idea of thank yous are assumed. Don't assume it. So that's my closing statements. I stand by that.
That's a good statement to stand by. And thank you for your time. And I genuinely mean it. It means a lot to have deans take time out of their day every single week. not that many people I know would do that. And I know this is such a pressing issue and just something you're really passionate about, and just you're passionate about the SPH community as a whole. So thank you so much
Well,
for
great. And don't
taking
forget,
this time out.
stay healthy, everyone. Stay healthy and follow the rules.
Of course. Well, thank you everyone for watching. And if you have any questions or anything at all, please just reach out to SPH through this Instagram or through the email, and we'd love to get to them next week. I hope you all have a great week. Bye.